Welcome to the We Level Up Treatment Center video series. In today's video we will discuss high-functioning autism. Autism is a developmental disorder that affects communication and behavior. While it can be diagnosed at any age, it is often referred to as a developmental disorder because symptoms typically become apparent in the first 2 years of life. But what happens when you didn't receive a diagnosis as a child, and you start noticing the signs of high-functioning autism in adulthood? Let's delve into this. Discovering autism in adulthood. Perhaps you have, like many adults, noticed that your way of thinking, feeling, or doing things isn't quite in line with what's considered the norm. Maybe your social skills, body language, behaviors, or interests don't align with those around you. Or perhaps, you have a child who has recently been diagnosed with autism, and you recognize some of the same issues in your own behavior. In recent years, the concept of neurodiversity has gained traction, emphasizing that individuals may have neurological differences, which should be respected rather than corrected. However, a diagnosis of autism in adulthood can still be a significant shock, leading to emotions like anxiety or denial. On the other hand, for some, it can bring a sense of solace, as it offers clarity to many past experiences that may not have made sense. The goal of treatment. The primary goal of treatment for adults with autism is to help them lead happy and fulfilling lives. Many adults with autism have struggled because they've been misunderstood throughout their lives, often without understanding themselves. Questions like, "Why am I so clumsy?" or "Why do I struggle in social situations?" can finally be addressed and answered through the right treatment. Signs of high-functioning autism in adults. Autism, even in its high-functioning form, manifests through various signs and symptoms. These signs are most noticeable in emotional and behavioral patterns, communication skills, interests, and sensory sensitivities. Communication can be a significant challenge for adults with autism. They may have difficulty reading social cues like facial expressions, tone of voice, or gestures, making it hard to engage in meaningful conversations. Sarcasm and figures of speech can be particularly tricky to detect. Some individuals may use a monotone voice or have minimal facial expressions, further complicating their interactions. Narrow interests are another common trait. While we all have our unique interests, adults with autism often hyper-focus on one or two subjects they find highly engaging. This specialization can limit their ability to participate in discussions on other topics, and may make connecting with others challenging. Repetitive behaviors, a hallmark of autism, can help maintain a sense of order and security in one's life. However, disruptions in routines can lead to intense emotional responses, like anger or frustration. Sensory sensitivities can also be challenging, as certain stimuli, like touch, sounds, or textures, can be uncomfortable or even painful. Adults with autism may go to great lengths to avoid these sensory triggers. Diagnosis of autism in adults. Diagnosing autism in adults can be complex because there are no standard diagnostic criteria for this age group. The diagnosis process typically involves in-person assessments by clinicians, psychologists, or psychiatrists. They rely on self-reported symptoms and often gather information from family members about an individual's behavior throughout their life. In some cases, parents are asked questions from the diagnostic criteria for children to provide further insights into the individual's childhood behavior. Inpatient treatment for adults with autism. In some severe cases, inpatient treatment may be necessary for adults with autism, particularly when they exhibit treatment-resistant and severe behavioral disorders. Inpatient care becomes the highest level of intervention when community-based support options have been exhausted. Types of therapies. A range of therapies exists to address autism in adults. Applied behavior analysis, ABA. A commonly used therapy, ABA focuses on encouraging positive behaviors through a reward system. It includes discrete trial training, early intensive behavioral intervention, pivotal response training, verbal behavior intervention, and positive behavior support. Cognitive behavioral therapy, CBT. This talk therapy can be effective in helping adults with autism understand the connections between thoughts, feelings, and behaviors. Social skills training, SST. SST helps individuals develop social skills, including understanding humor, maintaining conversations, and reading emotional cues. Sensory integration therapy, SIT. This therapy aims to even out a person's response to sensory stimulation and is often conducted by an occupational therapist. Occupational therapy, OT. OT focuses on teaching essential life skills for adults, such as cleaning, cooking, and managing money. Speech therapy. This therapy focuses on improving verbal skills and communication. Medications for autism. While there are no specific medications for ASD, certain medications may help manage specific symptoms, such as irritability, aggression, repetitive behaviors, hyperactivity, attention problems, anxiety, and depression. It's crucial to use medication under the guidance of a healthcare professional. Support for adults with ASD. Unlike children with ASD, adults often don't receive the same level of support. They may need individual or group therapy, counseling, vocational rehabilitation, or medication, depending on the challenges they face, such as social isolation, anxiety, relationship problems, or job difficulties. Many adults with ASD find support through online forums and groups, and by connecting with others who share similar experiences on the autism spectrum. Autism tips for daily living. To foster healthy social lives, adults with ASD can consider disclosing their diagnosis to close friends and family, and it can help them better understand your challenges. Additionally, recognizing sensory overload and finding common ground in conversations can make social interactions more comfortable. Autism isn't a disease that worsens over time, and there is no need to cure it. The focus should be on understanding one's strengths and challenges. Early intervention is crucial, and treatment should begin as soon as possible after diagnosis. There is no one-size-fits-all approach, and finding the right treatment program involves working closely with healthcare professionals. Let us remember the importance of empathy, understanding, and support for those on the autism spectrum. By doing so, we can help individuals with autism lead happier and more fulfilling lives. The We Level Up Florida Behavioral Center is unique in offering unparalleled evidence-based programs, along with ultra-modern therapeutic modalities to advance mental health treatment outcomes. If you have questions about your diagnosis or want licensed guidance or therapy for fear of abandonment, don't hesitate to contact us. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.